Yeah, so I think that the age has become a much more relevant question over the last few years as there has been a changing incidence in the incidence of colon and rectal cancer in older and younger adults. So we have been seeing a decline in the incidence of colon and rectal cancer in patients over the age of 50, and that's likely due to better detection with colonoscopy and the widespread implementation of colonoscopy and polyp removal. But what we're also seeing is an increase in patients under the age of 50, specifically in distal cancers and rectal cancer, so left-sided and rectal cancers. And these are patients that would not normally be screened, but yet present with advanced stage disease, poorly differentiated tumors, and then come to us with a tumor that, although globally has a poor prognosis, the younger patient may actually have a better long-term survival because of their age and lack of other medical issues. So now we have two very dichotomous groups of patients. We have a younger survivor with a more advanced cancer who may live a long time with their cancer or after their cancer. And then we have an older adult who may be presenting with a cancer but may have comorbidities and may be more frail. And they may have the same stage of disease, but they're two very different people. And so I think it's important when you're thinking about age and what you're going to offer someone for treatment is how to assess their tolerance of therapy and whether their cancer is going to be the most primary problem or there are going to be other things that drive your long-term prognosis. So for a younger adult, you think not only about the stage of their cancer, but also how these therapies may impact their ability to work, their ability to continue to function in the roles that they're currently in, how the side effects of treatment might impact them psychologically, financially, and have that conversation as you're beginning your treatment plan, because this is going to be a long haul marathon for these patients because their long-term survival may actually be greater than in an older adult. Whereas in an older adult, you may be looking at them and thinking, okay, what are my other medical problems? How frail is this patient? Do they have the type of support to be able to receive therapy? Because I could actually hurt somebody if I use the same intensity of chemotherapy as I did in the younger patient. And you have to tailor those two patients with the same stage of disease very differently, because one may have other comorbid conditions that compete with their cancer for long-term prognosis, whereas in a younger adult, it's going to be about their colon and rectal cancer. And so you have to think about those patients very differently.